Welcome to Genomics Gupshup. Genomics Gupshup is an initiative by MapmyGenome to create a community around genomics and to simplify genomics for everyone. And we do this by bringing together experts from allied areas like medicine, genetic counseling, nutrition, fitness, and more. Please join us as we spread the word about this exciting science of genomics. We are now present on your favorite podcast as well. Just search for Genomics Gupshup on Apple, Spotify, Amazon, or Google Podcast. Today, we are very excited because we're going to have a very different format of how we're going to do Genomics Gupshup. And we are very excited to have Dr. Rajeev Sharma, who heads the medical affairs at Tata 1mg. He's been involved in building several other startups and has also have startups or built startups of his own in the healthcare space. Welcome to the show, Dr. Rajeev.
Hi, welcome to you too. Thank you so much for having us and me on this very interesting concept of Gupshup. Let's start, whichever way you like. And, I think people won't know, but I know Anu for a very long time. And, if there was one person if I had to name from bioinformatics or engineer in a bioscience genomic space, it's Anu Acharya. So welcome to you too, and let's begin the conversation. I think before we go ahead, Anu, I would really suggest and request if you could tell us a little about yourself. In terms of how did your journey move from being an engineer to a totally bioscience person and taking a bet on something very novel and new in genomic space many years back, and then with MapmyGenome, I think almost a decade back, if I'm not wrong.
Absolutely. Yeah, thanks so much. So I think this is a question I get asked often, that you went to IIT, how did you end up in genomics? And I think today IITs do have a lot of biotechnology, but when I went, which was many years ago, we didn't have that, right? But I was fascinated by physics. I was fascinated by all things, people like Richard Feynman, Albert Einstein, and all of those interesting ones, Oppenheimer. I think you might have seen the movie and so on, right? So we did all of that, but I went to the US, worked for a startup, and worked for another large company. And around that time, I think was a very exciting time for startups in general, right? Because it was a time, this is time just before Google. Just before Google came out. So there was not really much in terms of the search engines either. So once we got in, we were trying out a lot of different ideas. And one of the ideas that was proposed to us was, can we do something in the genomics space? Right? Or not, it was not called genomics at that time. It was called bioinformatics mostly. Right? And when we searched for that on InfoSeek, because that was the search engine that we had at the time, there wasn't much information, but we read that the whole genome project is just about to get completed, and this was going to essentially create this whole software for the human body, right? So coming from a background where I was helping in a lot of systems, I think for me there was nothing more exciting than decoding our own system, really, right? Our own software. So I thought, sounds great, and maybe this is something intellectually challenging enough that we can solve as a problem. And so we moved back to India with this idea, without having the requisite knowledge at that point of time. But we did have a founder who also came from this background. And that's how we started the journey with Awesome Biosolutions. And that was exactly 23 years ago, which means that, there are 23 pairs of chromosomes. We now have 23 years of experience. So I think, it's an interesting time to be having this conversation. But we started this, and it was a fascinating journey because we were literally the first, company to get started in this space. There were one or two companies also that came around the same time, I think, in 2001 and so on. But we started off, we built software, we acquired 3 companies, mostly outside of India. We became one of the largest genomic services players. We had databases that were used for early discovery and so on. We worked with a lot of the US FDA, US EPA for some of the databases that we had. So very exciting journey, I would say. But at the same time, I really felt that there was a lack of data that would push the Indian population towards personalized medicine. That was number one. And the second thing was, when I looked at what was going on in healthcare, I saw that most of the time people were looking at it in terms of how do you cure something, right? How do you cure somebody who has a problem and so on. So I was thinking that, the curve in terms of how much you spend at the early stages versus late stage is skewed towards, you spend very less at early stages versus late stages, but people normally don't even bother to do that because they feel there is no outcome that is attached to it. So preventive medicine, in my view, was something that would be very, very exciting. It would be something that we could actually use it for saving a lot of lives. Right? So that's how we got, moved into something as exciting as MapmyGenome. And I think, we got started 10 years ago and created this whole category called preventive genomics or consumer genomics, as it is called sometimes. But it's fascinating because it was a great time to get started, but it was, again, like Osimum, there wasn't enough education about this space. So we had to, when you create a category, you're basically also tasked with the role of educating the rest of the consumers as well. So that's how we got started with MapmyGenome 10 years ago.
Fantastic. And I think, you said 23, years with 23 pairs of chromosomes. So, I'm sure the next 23 years for the second half of the pair.
Second half, yes.
Let's hope that for genetic science and bioscience. So it's very interesting because even at Tata 1mg, we take a real pride and focus on preventive medicine because till now it's all been therapeutic medicine or curative medicine. Now we are also pushing and trying to make our users aware that preventive medicine is far better, which was a concept in our Vedas with Ayurveda, but we are going back to probably the same. And we are also, through our diagnostic tests and packages, as well as general lifestyle modifications, we are also professing and trying to teach our users that preventive medicine or preventive lifestyle is much better than going into the curative phase. And that's where the world is heading now, with all vegan movements and different diets, some of them fad, but yes, I think we are all talking the same language, and that's a good thing.
Absolutely. I think even in terms of education, right? I think I do remember, like, even when Tata 1mg, when it was 1mg before this thing, that the created this whole wealth of knowledge around medicines, and I think those are things that not many people thought of at that point of time, right? So it's a great thing to see that whole evolution. I think we've all lived through this process of where we had to create something like that, but today everyone takes as granted, right? So.
Sure. Oh, very, very interesting. Thank you. And, personally, I've been very, very fascinated by genetics, even during my medicine days. And I think, and I can, with the information, I can totally call you a nerd or a geek with all Albert Einstein and the books that you've read, and I'm sure a lot of other interesting books on genetics and genomic science. But for us, we used to have biochemistry and physiology and immunology, and that would give us quite a bit of meat into as deep as at a DNA level or a chromatin level or genetics level, and a few other things. So I think what I would request for everyone to understand from you, not making it very biology heavy, but from you, you're in a consumer market space from a genetic standpoint. But could you explain, what is genetic mapping? Because you call, the company is called MapmyGenome, and what is mapping and how do you do it? I think it'll really help for everyone to understand.
Absolutely. So Dr. Rajeev, so basically, I think what you're doing is you are trying to understand what is there in your DNA, right? And our DNA is basically all the 3.2 billion base pairs, which lies inside each of our cells, right? So you have this material, which basically is like an instruction code for the cell to say, this is what you need to do. This is how you do certain things. So it's like basically an instruction manual for our human body to basically function, right? So when you are born, you have basically just, an egg and a sperm, and it becomes a human being, right? And how does it do that? Basically, it comes with a set of instructions, and that's your DNA. And the whole set of instructions, or the whole DNA that is there in that whole thing is called a genome, right? Now, earlier you could, like, as most doctors would have read a lot of different parts of human body, how it functions and all of that. But I think what we are doing in genomics is basically saying, can we now read those instructions itself, right? So if you read the instructions, there are different types of instruction that you get. One is your base level code. And by base level code means that what you inherited from your mom and dad, and you don't necessarily get exactly your mom and dad, but you get a combination of some of the data that your mom or your dad gave you in approximately, let's assume 50-50, right? Or whatever. You're getting that DNA code. And that's why, all your siblings look somewhat alike. They have some behavioral similarities and a lot of those things. So basically, you're taking that information and you read it like you would read a book. You read it in A to Z. We read in A, T, G, and C. That is your letter of your DNA, right? So that's essentially what we've been reading. And A, T, G, and C are basically these base pairs that are there. And I'm sure everybody now knows about A, T, G, C, thanks to COVID, I think. We read about RNA, and we are basically reading DNA, right? So basically, you get this set of instructions, and we are reading this out either as the whole thing, and the whole DNA instruction would be about 3.2 billion base pairs, or you read parts of that, right? So when you are reading for a particular test that you do, for instance, like an RT-PCR test or something like that, typically you are looking at a specific part of that genome, right? In the case of COVID, people looked at that specific part to understand if it was COVID or not. Similarly, I think when you look at it from a human body's perspective, there are certain genes that are there which gives you like there are about 20, 25, 21,000 genes that are there in your human body that tell that what needs to be done and so on. So what we would do is, you will map this entire sequence out. You find out which are the parts that are genes, not genes, and so on. So there are parts that are what we call as functional, that converts into a protein or something that is required by the human body. And there are other parts that do a lot of other functions, whether it's regulating the body or otherwise, right? Now, all that might be maybe a bit, let's say, too much, but basically you have to assume that if you take information that is coming from your genome, that based on which chromosome it is, we talked about the 23 pairs of chromosomes. So based on which pair of chromosomes, which chromosome it is, which location it is, it has a certain job to do, right? So what we would do is we'd pick these specific parts of the genome, and the ones that are contributing to either how you look, or contributing to why you behave the way you behave, or why is it that some people might be predisposed to a particular disease because your biological pathways get altered because of that. That understanding of what that sequence is helps us to be able to give a lot of information about a person, right? And people often think, okay, fine, are you going to tell me about a lot of the diseases that I'm going to get? That's not necessarily the only thing that you can get out of mapping a genome. So when you map a genome, you can get fascinating things. So let's just take the part that you got from your parents, and that doesn't change, right? So whatever you got, your cells keep duplicating, replicating, and you still continue with that same information. So you take all that information, and that information we would then create as a report that's easy for a consumer to understand. And so when we first, for instance, when we created Genomepatri, which was our first product, we basically helped people understand certain kinds of nutritional needs that they may have. You might have noticed that some people are more likely to have a deficiency than the others. Or you can understand if there's certain behavioral patterns that are there in individuals. Or you can even look at things like cholesterol and others that people might have a higher propensity towards or not. And then, of course, there are disease risk, There are things like you understand whether a medicine will work for you or not, right? Now, this is one kind of set of information that you can get, but there is more things that you can get from mapping your genome. And the one area that maybe is fascinating for a lot of people is, where did you come from? Right? We all know that we've evolved from, whether you want to believe from Adam and Eve, or whether you want to believe we came from Africa or otherwise, which is where the evidence points towards. I think we basically see that humans have evolved over many, many years. We can sort of, also see that. So there are many aspects of what you can do with genomic information. This is one of them. Then there are parts of your genome that change. For instance, what we call as, in the case of cancer, for instance, a lot of changes happen. Right? So we call those as the bodily changes. And that is another thing that you can do with genomics. And there is, of course, there's much more that has happened now with the microbiome and the epigenome, but those are different parts of understanding genetics or genome. Sorry to give a long-winded answer, but I think, essentially, I think if I break it down, you are basically, like you read a book, we are reading the whole genome. We are, think about it as chapters being chromosomes, your genes being your paragraphs, and your particular parts of where it is, where you would highlight them, right? Like when you're reading a book, you highlight certain things. You consider those as your markers. And that's what we would read, either the whole thing or parts of that gene.
Fantastic. That's like Genomics 101. Thank you. I think the first time I heard about Genomepatri or Genepatri, right? It's such a nice term that you've coined. It's almost like marketing brilliance, if you ask me. Because we always, everybody knows about Genomepatri, and then you suddenly come out with Genomepatri, and it's very fascinating. How did you come about the term?
So interestingly, so I was reading there was a book I was reading. Actually, it was a book on finance. Right? So, and I was on a beach, I was reading it, and I kept thinking about, just risk management and all of that. And suddenly I said, all this is great, right? We know what to do technically with it. Like we know how to analyze this data, but how do you tell consumers when they don't even know something like this exists? Right? So is there something that you can see a parallel with? And I think the one thing that I saw a parallel with was, there is a Genomepatri, and I do have, like, I'm an Acharya, so there is obviously a lot of people who are involved in some of these activities in my family. And so I was familiar with the Genomepatri. My dad was a physics professor, also dabbled with, doing something in astrology and all of that. So in some ways, I was exposed to those terms, right? Even though my Genomepatri, I don't even know was ever made, right? But that's a different thing. But I was exposed to the fact that there was this concept, and people believed in looking at it for understanding their health, understanding, who you should get married to, and understanding, certain kinds of activities, which essentially was what we were doing in a Genomepatri, right? So I, suddenly that idea struck me that, people already know what a Genomepatri is. And a Genomepatri basically is a scientific way of helping you understand, whether what kind of foods you should eat, what kinds of, diseases you might, how your health is going to turn out, as well as understanding, understanding which kind of partner is likely to be good for you based on your career status, right? So it was not so much based on looking at stars, but looking at your own DNA code that we could help understand. So that's how it came to me. It came in a flash. Of course, my co-founder was not that excited about the name Genomepatri because he felt it was too flimsy and not very scientific sounding. But I think it was, I think ultimately, I think it was great. A lot of people got it because, in the course of education, it's not just scientists that are involved. I think we have to think that when we are talking about healthcare to an average consumer or an average journalist, I think, or somebody else, I think you need to make sure that it's something that they are familiar with rather than tell about all the gene names and how brilliantly we created this polygenic risk scores and all of that. I think it was more important to say that something like this is available and it's available for any consumer and that it could come to their homes, right? So that was more thought process in my brain at that point of time.
Nice, very nice. Super interesting. Just one question to follow up. I think what you rightly said, that we can, to a certain extent, read and predict few scores on what could be the risk related to certain type of diseases, and what medicines could work for you, or even what's your. I remember you talking about a cosmetic related beauty score of sorts, and also a few other scores. So how accurate are these? Because I assume when you're reading, we are basically what we're doing is we are statistically trying to read these and match these with the exact diseases that are, or the effects on body of few people, right? And when I say few million people, so how accurate is this? And then secondly, especially from an Indian diaspora point of view, how accurate is this? Because most of the data, even the human genome project that I think it just completed, or it's still ongoing, even that was more on American population and a few other Hispanics or whoever is there in the US. But how good and effective is it for Indian population? So I think these are two questions that I've always thought of, and now that I have you, I'll ask you.
Sure, absolutely. So I think there are two parts of it, right? Like when you look at it from an accuracy perspective, one is, are you reading it right? Right? Like when you are reading something on your genome, do you get the right information, right? Am I making sure that the A is an A and a T is a T and a G is a G, right? So that is one part. And there we have 99.9% accuracy. So that's not a problem. The second part is that, when you look at the whole wide world of genetics, there is either something that is, they are varying scores of how they contribute to a disease or a condition and so on. So when you look at something which is a disease like diabetes or hypertension or something, or any of those things, there are many genes that may be involved in that. And it's not that it is a single gene and that single gene is causing a problem, right? And those, we also have those as well. We call those as a carrier status, where you have it and the other partner has it and so on. So the way we are looking at it is saying that, when you're looking at a polygenic risk score, which is basically saying that a disease that is probably a lifestyle related disease has multiple genes that might be affecting the outcome for the patient based on not just the genes, but also lifestyle. There are two parts that you want to make sure. One is, did you get the markers that are there, which are accurate? And the second is that your outcome is not going to be only dependent on the markers, right? So for instance, I might have a risk for type 2 diabetes, but genetics is only about 23 to 26% of what your outcome is. The rest of it is all what you're eating, what you're, how you are, exercising and so on. And so when you're looking at a polygenic risk score, you have to take both of those into account, right? So therefore, it's not that we are telling, like if you do in a blood test, if your HbA1c is an 8, you are clearly diabetic, right? But in this case, you're saying that maybe you're 2 times at risk of diabetes, which means that if you had the same, 2 people, like, they are doing the right kind of things, the other person is not doing the right kind of things. The chances of, if you have that genetic variant, is that you will probably get to that finish line faster, right? Like you will get to diabetes sooner. So that's the thing that we are helping people understand. The same thing is, let's say if you take something like, data like an ACTN3, and this is something I often have a discussion with my kids on, because ACTN3 basically tells whether you have a fast twitch muscle or an endurance kind of thing, or you are somewhere in between. Now I have the fast twitch muscle, which means that if I had trained well, which I have not, I could potentially run faster than most people that probably will be with me if we train the same way. And that's something people forget, that if you train the same way, if you ate the same things, then the chances of you doing better are higher, right? And so that's the sort of thing that we have people understand, that the accuracy is, it's not about a diagnosis, it's more about giving you that information so you can do something about it, right? So it is about saying that you have this. If you want to make the best use of it, you should probably do A, B, and C, right? And that's what you would do in a, what we call as any outcome that has multiple genes or multiple markers that are there. The other thing is, you also asked Indian data hacking, right? Like, I mean, the truth is that 10 years ago, there was very little. Today, we have a lot more, and we have our own data as well, right? So 10 years ago, we started. At that time, it was hard. But one of the things we always do is we are not just giving people, you know, 100 pages, figure out. If you're at risk, you figure it out yourself, right? We are helping people understand if you are at risk, what should you do about it, right? Which means that people have to give in information about their family history and what they're doing and so on. So what we call as, in our language, we call as like, phenotype, and then you have the genotype, right? So we are taking both those information. And today, I think we have enough information for most of these conditions that allow us to be able to make these predictions much more accurate. And an example of that would be that very recently we published in a very prestigious journal called Nature about our type 2 diabetes polygenic risk score and so on. So there is enough data now. But of course, this is something that will continue to evolve and so on. So at this point, I wanted to ask you, Dr. Rajeev, you've done this Genomepatri, right? What did you think? I know that some things come later, and some people sometimes. What were your reactions to that?
It was very interesting, to be honest. Few of the things were bang on. And because Genomepatri happened with just a swab of, from the buccal cavity, so it wasn't that the person who was doing the sequencing and reading it out, matching it, was seeing me and telling about me, but the eye color or the skin color, and if I'll have familial male pattern baldness, all of that was quite bang on. One thing was, and some things were quite funny to know, because being a doctor and everything, it was really nice to know that I was on the lower spectrum of risk of almost all the diseases, which was a good thing. But I think, so I was quite happy, seeing the things. But some of them are very funny also. Like the chances of me, having a higher risk of a decomposing memory of sorts as I age, or something like that. So I think those are funny things, but I think all of that is it was quite bang on. So I was very surprised, because I was very skeptical about that. And even though being a doctor and knowing about it, I think inherently as human beings, we are not so forthcoming when it comes to knowing what the future holds. Because the moment, if you come to know, okay, you're susceptible to a cancer, or diabetes, or Alzheimer's, or a few other things that the report says, then I think that fear of knowing that what you could have may actually put you down under, and may have an opposite effect, which is probably the first thought people have. But I think as a doctor, I think, and we prescribe tests, and we prescribe preventive plans all the time. I think it's very important to know what you could have also, and now that we have certain level of accuracy in genetic testing, I think it's very important, because in the nick of time you could do something about it. So if there is a lifestyle modification, like you rightly said, if there is food changes, exercise that you need to do more, or I think even, let's say, if in my case, if it said that okay, there's a little higher chance of Alzheimer's, let's say, in that case, I could probably start doing more of mental health exercises, or, a few other things, and food changes, and maybe get my, hopefully by the time I turn 50, 60 or 70, there'll be more tests, which will not just be MRI and, EEGs, but, more predictive markers when it comes to blood markers. So I think I can just go more towards them. So I think that scare that if you get the test done, you will find a disease is wrong, and people should, throw it out. It is actually the other way around. If you get a test done, if you get your Genomepatri, one, it'll be very interesting to see, what's your makeup, and secondly, I think it'll really help you to prevent yourself from falling sick faster. आपकी जो life की रेस है, आप लंबे टाइम तक
Race का घोड़ा type.
yes, like if you knew you could have been a sprinter, but I think आप sprint करते तो हमें जेनेटिक का ही पता नहीं लगता कि sprint करना आप कर सकते थे. So I think all of that is important. So
Yeah,
fair.
so, one of, I think I missed out. You had asked about the whole beauty thing as well, which
Yes.
we look at what did we do about that. So I think there were two things, right? Like, you mentioned that some people or kuch logon ko dar lagta hai just to know, but I feel there are two aspects to that, right? One is, for instance, if you want to lose weight, what do you do? One, of course, you do the right things, but you also measure, right? So you are tracking, and the process of tracking, the process of writing down is the first thing that you would do to sort of see if you're actually doing it or not. It's the same thing. If you understand how your body functions, the chances of you doing something about it are more likely when you are aware. And that's what I tell. Same thing in, let's say, running a company, doing sales or anything else. If you don't measure, you don't track, it's not that, one fine day you'll suddenly wake up and then you'll see that everything happens. It doesn't happen like that. Right? So when it comes to your own health, I think it's important to track, and it's important to be able to understand what your inherent markers are. Right? With those you can't change. वो तो gift मिला है, parents say. So you can't change that, right? So that is one thing that we do. But we are cognizant कि कुछ लोगों को पता नहीं करना कि कौन सी बीमारी होने वाली है, and so on. Now, one of the things that you can do, and I think people are wanting to do, is I want to look better, right? I want to stay younger. And I think that's something that I haven't found anybody who said, no, I want to look not so good. I don't want to look young. And I'm not talking about a teenager, because a teenager might want to look older, but I'm talking about, most of us who after the age of, let's say 30, 40, we start to realize that, this is something that, you are suddenly seeing a potential end to your lifespan, if it is. So at that point of time, I think people want to either, look better, stay younger, or anything like that. And there itself, I feel that if people start to eat better, if people start to do the right kind of exercise, I think a lot of diseases are automatically prevented. So we said, can we build something that maybe doesn't give people information that might scare them, which is not really scary, but different people have different perception. Then at least they're doing the right things in terms of their diet and nutrition and exercise. That allows them to be able to actually, stay actually disease-free. So I remember when I recently met a lot of dermatologists because of this Beauty-Map product. And it was interesting because 2 or 3 dermatologists told me the same thing. They said, yeah, you think of us as being somebody who, prescribes creams or whatever, but all your health is visible on your face, right? What you do, what you eat, and all of that, 60, 70% is that. And ultimately, I think, when you break it all down, your food, your nutrition, your exercise and all are making a big difference in your life. So we said we'll create something that allows you to, find out which kind of a regimen will work for you, both in terms of diet, but also in terms of what kind of products might work well for you. And that allows people to be able to look at it more as something that is not scary. It's something that helps them achieve what they want to do. But at the same time, I think also helps in many ways. We have better health outcomes. So I said, if it's okay if it's whatever motivates people. If it motivates them to make the right changes, I think we are all in a win-win. So we created BeautyMap, we created MyFitGene and MyNutriGene. And these are based on specific areas that people are excited about. So that, if they don't want to know about Alzheimer's, they don't want to know about type 2 diabetes, it's okay. But at least if they're doing the right things, then, if they find out that, let's say, they are deficient in vitamin B12, for instance. And I often tell this story about my own B12 discovery. Was a doctor almost was about to operate me, right? And said, you have carpal tunnel syndrome, and for sure you've been, you work on the computer so much, you are always there. That's the problem, right? And they're ready to operate me until I got a second opinion. I found out that I was deficient in B12. Now, of course, we should have done your preventive tests. Many years ago. We didn't do those preventive tests. I didn't do B12, for instance. But in my Genomepatri, that also was very obvious, right? So if I had done that even before, like 20 years ago, I would have known that, I'm at risk for B12, and therefore I would have done a B12 test. So that is the whole purpose, right? That you can find out if you are at risk and then do those tests. Because otherwise, many people say that, yeah, okay, preventive test, you do a smallest part of what you need, right? Maybe they just do the whatever is the cheapest Tata 1 mg package, right? For instance, I'm giving an example. But if they knew that they had a risk for, let's say, breast cancer, they knew they had a risk for something else, the chances that they will make it about that test also is very high. So I, for instance, also make sure I check my HbA1c, I track it, I check my lipid profile, I check a lot of these other things, and I do the ones that I'm more likely to get at a 2-month, 3-month interval versus a 1 year where I would do a whole checkup. Right? So I think that's the difference that we would look at in terms of saying, how is it going to make a difference in my life? And I think today I'm happy to say that, my metabolic health is far better than what it was maybe even 15 years, sometimes 10, 15 years ago. So I think that's the big change you can make in your life.
No, I think, especially with reverse aging, the whole concept has taken a new shape and light these days with celebrity biologists like David Sinclair and a few others, even millionaire Brian Johnson, talking about reverse aging talking about aging as a disease rather than phenomenon. And what they're saying is that with certain modifications and changes in lifestyle and some inputs when it comes to dietary requirements, one could potentially reverse age. And like you rightly said, that physically one could be one age, but metabolically or the biological age of the person could be something else. So I think that ways, I think I also very strongly feel that genetic testing can really help you to have an aided decision making along with all the rest of the blood tests and markers and your skin turgidity and all the rest of the medicinal markers. This could really help you to have a long-term view of what could really benefit, like you said, B12 and vitamin D and few others. So fantastic. This is very, very enlightening.
You mentioned all these biologists, right? And I think today, I think someone told me recently saying that, unless you're living under a rock, I think everybody has heard about a lot of these tests. But the reality is, I think we live in our bubble, and not everybody is aware of these tests. So maybe if I can just touch upon some of the things that are there. So right now they've discovered that there are about 12 hallmarks of aging, right? And when you look at aging as a disease, you're looking at all these 12 hallmarks of aging. And there are few things that you can do. Obviously we talked a little bit about some of the lifestyle and other things. But there are some areas where you can today you can also measure what those changes are doing using genomics also, right? Like when we first did Genomepatri, it was more a static information, right? Like you can do it at birth, you can do it when you are 99 or 100. That information is not changing, right? So that's a great piece of information to know. You do it once, you don't have to keep doing it. But let's say if you are saying that, I've been doing all the right things. If that information is not changing, how is it helping me? Right? Of course, you can know by using blood tests. And one of the things we are doing is we're saying, we'll take machine learning, we'll put these pieces of information together, right? How you're measuring your blood information and your genetic information and so on. And we'll give you a score so that you can say what's going on with your health overall. That is one part. But the second thing, and I think recently we had launched this, was the gut microbiome. And I think a lot of people you would have heard talk a lot about gut microbiome, what is there in your gut, and how does that even help? And not very long ago, I think we had very little information about the gut microbiome. Like technically you could sequence, but the information or interpretation of that was still quite far off. Right? And also what action you do take. Today, I think that is changing. So for instance, you take a sample, and that unfortunately is a stool sample, you can do an oral microbiome, but let's say if you take a gut, you typically take a stool sample. And then you are finding out what all bacteria are there, in what proportion they are there, what kind of fungi and all of that. And one would think that, okay, fine, all of that is there. How does that help me? But it's fascinating. It'll tell you what you've actually been eating. It'll tell you about things that are actually going on with your mental health and many other things, right? And so it's a interesting way to be able to understand whatever changes you have made, can you read them? The second, which you mentioned, I think was, can you find the age, biological age versus chronological age, if you will. So there are many such clocks, right? So many universities have developed what they call as the biological clocks. And typically you are looking at certain changes in your genomes that you are studying. And those changes, or we call like a methylation or otherwise, we can then use that information to create back. So let's say if today you are, by your date of birth, you are 50 years old. If your biological clock says you are 60, that means you have been doing something very wrong, right? I mean, that you are aging faster than normal. If your biological clock says you're 40, which means that you've been, as you mentioned, reverse aging, right? So that is what we are looking at. And a lot of the millionaires and billionaires are now saying, people are putting in a lot of money to understand what they can do about it. So clearly, I think, if we talk, we can probably talk for another 2 hours on this subject itself. But there are many things that people are doing, right? Including supplements, including looking at a lot of the new drugs that have come out today, whether it is like a rapamycin or a metformin or NMNs or many other such things. And maybe that requires another whole new episode of Gupshup. But what are your thoughts on that in terms of longevity and aging?
I think I'm with the idea of genetic data supplementing all the rest of the information, and I totally am of the opinion that aging is at a cellular level a disease. There are certain triggers that expedite aging, or your cells are we call it senescence, so they are kind of getting old, getting eaten up by the rest of the vigilant cells, let's call them, just for the sake of simplicity. So I also feel very strongly that if once we understand the markers, genetic markers, biomarkers, blood markers, environmental markers, how you were brought up in your family, I think various and different kind of markers, food that you take, exercises that you've done, kind of mental pressure or societal issues that you've faced, I think all of that data put together, with 100% genetic data contributing to majority of that percentage, I think will really help us to stop or let's say slow aging. I wouldn't say, I think at a certain level, the age cannot go beyond, I don't know, 120 is what most of the scientists say, that human age is supposed to be 120, but then there are conflicting views. Having said that, I think the quality of life till 100, till, furthermore, can be pushed to be much nicer. You could, I think one will be able to, and I'm very sure in our lifetime, we'll be able to see people living up to 100 and physically and mentally being more active and more in the present, responsive, living a better quality of life. And some of the learnings anecdotally could be from, few of the islands like Japan and few others, where people have been practicing certain ways of life, values, food habits, and whatnot. So I think I'm with, with the idea of, that reverse aging is not a fad movement. I think it is very much a reality biologically, as well as quite humanly possible, is what I feel. And I think you just touched upon one, point of personalized medicine, right? You said if rifampicin and others could be personally identified with the genetic makeup of a person, if that works for that particular person or not. And I think that's one space I, as a doctor, out of inquisitiveness, have been following for many years now. And I'm very excited with the promise it holds. I think right now we are going with simple, let's say, micro cultures, or blood cultures or stool cultures, where we look at bacteria and we then tell which bacteria, or what is the antibiotic that could help with that particular bacterial infection or virological infection. I think with genetic mapping, and with Genepatri also, I think Medicamap,
Yes.
of MapmyGenome, I saw those kind of information where I could see what medicine would work for me, if, or what medicine has a chance of being less responsive to my condition, if at all I get a heart disease or a whatever disease. So I think that's the direction the world is moving towards. Yes, I think still a little bit of cost factor and availability, accessibility is there, but I think over a couple of years, that I wouldn't call it 5 years or 10 years, but could be just 2-3 years, I feel things will be much cheaper, much accessible. And already I was part of a discussion team from Emory University once, and we were talking about CAR T cell therapies, and we were talking about like you rightly said, microbiome of a gut. We were talking of different kind of proteomics, metabolomics, genetics, all these mix, the omics that are there. So identifying even from a blood various metabolites that are present because of certain level of bacteria present in the blood, or certain level of infection that is there, or inflammation markers, or in, like you said, COVID, we all got apprised of something called cytokine storm. So
Yes.
cytokines are there. So I think all of those different types of cytokines, or metabolites that one can take from the blood, and then put that data along with genetic data, and then figure out what medicine would work for you, how your disease is progressing, like you rightly said. And we specifically, were talking about cancer here. So we were looking at how the treatment, because cancer, still could be a little bit of a hit and trial with various diseases and regimes. So what medicine was working for what type of cancer, and with all of these omic tests put together, it was almost like defining the prognosis of the treatment, not just the disease. So talking about how the disease is progressing, how the treatment is progressing, and then even with latest CAR T cell therapies and whatnot, taking the cells and then genetically modifying and then putting them back, and before putting them back, identifying what responder will really work and really benefit from a CAR T cell treatment. So I think, again, it may be getting quite a bit technical, but the spectrum is so wide with this test, and it's very fascinating, because yesterday only at Tata 1mg, we just put together something called Ayurveda dosha assessment. And what we were doing was, there was a set of questions of 4 or 5 minutes, and then you have a result that comes, and then you have another 4-5 minutes of questions, and these are all curated by putting Ayurvedic doctors together. And the first 4 or 5 minutes of your questionnaire actually tells you your prakriti, and then the next 4 or 5 minutes tells you your vikriti. So it's actually very similar to what you just said, that you're born with a certain set of code, and then your environmental factors and societal factors, and how you're growing up, that influences the rest of it, and then that's what becomes your new sort of vikriti. So I think we're going, I think fundamentals were there from before in our science, Ayurvedic science, but I think now that it's getting more evidence-based and scientific, I think this is when we'll see more adoption. So 100%, I think we'll have to cut it short and put it in perspective. Reverse aging will happen.
Great. And I think you basically summed it all really well with the Ayurveda thing. I think I find a lot of commonalities between ultimately genetics and genomics and Ayurveda. It was just that at that point they didn't have that many ways of measuring things, so they looked at physical attributes and they looked at how you did things. But now you can, right? And I think therefore you see a lot of connections that are happening. In fact, a lot of Ayurveda doctors are also using genomics now to make those assessments. And I think that marriage between the old science, which has worked for thousands of years, and now the new science, I think is where I feel innovation will happen a lot in the coming years.
Fantastic.
And you mentioned about Medicamap, so maybe I will tell a little story about what my husband, it showed that statins won't work for him, right? And Genomepatri had shown high triglycerides. And 10 years ago, everything was fine. Everything looked like he doesn't have problems, and he's very healthy. He's very all of that, but he was careful about triglycerides anyway. The whole family has a history, so it's more a genetic risk rather than necessarily a lifestyle related thing. So doing normal things, I think his triglycerides went high when he reached close to 50. I think we couldn't really do much about it. Whatever you do, you change your diet, you change exercise and all, nothing was happening. Then he said, okay, fine. The doctor prescribed a statin. We said statin won't work. And they said, okay, try another statin. And even that statin, I think, was not, the medicine basically would not function the way. And he was getting pain in his this thing. I think some people do get that. So he said, fine, what do you do? And so ultimately, I think the thing that really helped him was, he started doing intermittent fasting and then 1 meal a day. And I think that solved that problem. So it was more think about saying, okay, what will actually solve that problem? And if you are aware, then you are likely to make those changes, and you'll be more motivated. And when you see that happening and you see that everything is getting back to normal, I think that excitement about using this science becomes all the more fascinating. So I think that's what we are hoping people can do, that they can use information and use it to their advantage, right? Use it in a way that that you don't think that genetics is your destiny, even though it is what you are born with. And like you see in Ayurveda, that things change. I think it's the same thing. What you do with your body and your environment, I think ultimately determines the course of how your health span is going to be, how your lifespan is going to be, and how you can live a more healthier life. And maybe we'll all pop one day, but at least when you do, you are not bothering people, and you're not making the others around you also dependent, right? And I think for me that would be a very important thing, right? When I ultimately I want to be happy, maybe who knows what happens with, at least while I'm living, I'm living a happy life and healthy life. That's more important to me than saying I lived up to 120, for instance.
Hoiga, I'm sure. I think one important point. So I think we discussed about, a few things, and especially knowing about your genetic makeup and, few raw data information that, comes from your mapping, as well as, a few other things put together. I think, in my opinion, and you practice it at MapmyGenome, after you get the result, counseling will really help. from an adoption point of view, and it helps, in present also, because I think it alleviates the fear from people, and they understand what this really means, because the interpretation and the perspectives may mar the exact information that one wants to pass on. But I think with counseling, genetic counseling, and counselors, which are very few in the country, I feel, I think it can really alleviate the fear in the minds of the people that okay, genetic mapping, or getting to do more of tests is actually bad because it may surface some disease, when on the other hand, it's actually making you aware of something that may happen, which you can actually prevent in the nick of time. So what do you think? How do how does counselors how do counselors play an important role at MapmyGenome?
So, I think you've got absolutely the right piece of what happens with consumers when they first get that report. And clearly, most of us will have something that you are at higher risk for or not. So, while in the past, I think most counselors were focused around a genetic disorder, which basically means that you have the disease, right? Or a baby is likely to get it, or so on. When we started using our genetic counselors to explain the overall risk from a preventive point of view, I think we realized that that was a very important time. It was also sometimes the first time they were talking to somebody in that level of detail on how is it going to influence your health, right? And I believe that genetic counseling, whether it is for a genetic disorder or for prevention, I think is the cornerstone of what you can do with genomic information. Because ultimately, whether we like it or not, humans want somebody to tell them about how they can actually make those changes. I think it alleviates the pain of seeing a risk, because it's not a diagnosis. And when you first see it, maybe unless someone explains that to you, maybe you will have doubts about it. So it's important that they help explain what this risk means, and what can you do about it, right? So I think getting information is not enough. I think you have to make some actions, and I think having that genetic counselor makes that connection between you taking that action and you getting that information. So I think they are the most important, they're most important in getting people to actually make those changes. They are also very important to talk to doctors, right? For instance, when a doctor prescribes certain tests, genetics like exome sequencing or anything else, many times I think doctors have not been taught this in their medicine. I'm sure, I don't know if you learned a lot of medicine, like during medicine, whether a lot of genetics was taught. In fact, probably it wasn't even there in textbooks, and that knowledge wasn't even available, because this whole genetic mapping started in 2000, 2001, and now we have sort of closed, hopefully closed the chapter on the base level sequencing for a lot of people. But like you mentioned, I think some population, we still need to do a lot of work. So I think genetic counselors are also extremely important to be able to talk to the doctors, help them explain what the result means. Right? So let's say if you find what we call as a pathogenic variant, right? Something that will induce disease or cause disease. I think it's important to also tell medical practitioners what that means from a genetic point of view, and also what they can do about it. So genetic counselors are playing an important role in talking to families and talking to patients, but also talking to medical professionals and explaining what a result means and how they can change their treatment protocols or their discussion with their diagnosis based on this information. So I think they are, in my view, very, very important from both these angles. And we have always made sure that with every genetic test there is a counseling that goes with it.
Nice. So I think maybe few of the last questions or my thoughts, I think, and also would love to know your thoughts on these, in terms of biggest challenges, to close, especially in India, right? So what are the biggest challenges that you're seeing when it comes to adoption of genetic mapping, gene testing, in the minds of consumers, And also because, ultimately, one of the centerpiece in the healthcare ecosystem is doctor, or rather the centerpiece, I would say. So how is it, how is it going when it comes to breaking the ice with the doctors, let's say, when it comes to genetic testing? Because like you rightly said, we were taught medicine in a certain way. Yes, very aware of the the biochemistry and physiology and genetics. But I think the application of that when it comes to reading of ATCG and all of that, I think wasn't, it was only taught, okay, three make a codon, and how few of them are terminating stop and start codons and few other things, right? And then this could be this could be that amino acid. So I think it was very at a very cellular or genetic level understanding, but the application was not really taught. Makes it easy for doctors to understand, but definitely not there. So how do you see, because how I would feel is that, one, I think cost is still a kind of a challenge, because the benefits are not immediate. Plus, there is certain level of, let's say, risk percentage rather than a confirmation of a glucose or in the blood. So I think that's one. Two, I think from access point of view or awareness point of view, also people are not so much there yet. And from a doctor's point of view, I think, again, doctors also are trained to be curative and therapeutic in their approach. So I think that's where the whole preventive and wellness angle, to an extent, is not hardwired into doctors' minds, and they think of it more from, okay, patient has come, ab isko theek karna hai. And of course, when the patient comes in, they tell about what they should actually be doing, not doing for the future. But I think it starts from getting into a disease, the doctor journey. So how would you, do you have the same thoughts or any more, or, and please.
So it's interesting. I mean, the cost has come down quite a lot, right? I mean, I think today, when I look at Medicamap, which is basically we're looking at 165 drugs, and the cost is like 7,000 rupees. So you're basically paying 42 rupees a drug for your lifetime. So it's not, in my view, is not a lot of money you're paying. I think people pay more for one order of, let's say, Swiggy or Zomato, right? Like you order a food, this thing, and you're doing it once. I think it is worthwhile because it ultimately is like, giving you information for a lifetime. But I agree. I think it's something that people think it is, nobody is forcing them to do it, right? So for instance, when the government mandated COVID tests, I think everybody did it and everyone saw the value of it. Right? So I think one is that there is still not enough awareness, but the cost wise, it has come down quite a lot, right? So most tests, at least that we are priced at, are around 7,000, 8,000 rupees, which is, I think, comparable to a lot of like an executive health checkup, but you're doing it once in a lifetime versus not. The other thing that you mentioned about affordability, accessibility, right? Like, so I think that's another thing that we did. We said, it is harder to get people to actually draw your blood, even though in India, I think it is way better. I think, companies like Tata 1mg and others have made it much more easier to be able to get that for everywhere. But we did it with, you can even just take a saliva sample and do it, right? So you don't even need a person to come to your house or anything like that. You can just get it shipped. So as long as, e-commerce is doing well, I think, for us to reach particular places is not a problem. So I think that has also made it a lot easier for us. Like as e-commerce has developed over the years, I think it has also allowed us to be able to become much more accessible. But I think ek jagah jahan, we are not doing a good job is creating content in languages where people can actually understand what we are doing, right? When people understand, they definitely come, right? It is about that. So I think ये हमारी गलती है कि हमने हिंदी में ज़्यादा we didn't make much videos, right? Or in other languages like Telugu or many more. And so even though I can speak a lot of languages, I think we all need to create more education around that. And doctors ke saath to I think it is getting a lot better, right? I think today an average doctor is aware of genetic testing. 10 years ago, that was not the case. So 10 years ago, the kind of calls we used to get where about paternity testing, maternity testing, and maybe about thalassemia, cystic fibrosis, and some of the more single gene disorders. So it was on their own. I think now we are seeing that that is changing, right? We are seeing a widespread adoption in oncologists, in gynecologists, in neurologists that have started using genetic testing as a means for diagnosis, right? So diagnosis becomes easier, treatment becomes easier. Preventive part, I think we still have a little bit more. We see a lot more happening directly from consumers than from doctors, but that is also changing. So I think those are the changes that have happened in the last 10 years. But I think the next 3-4 years, we'll see a much more wider adoption. I think there are many more people who are aware of genetics. There are, and I think that is having a cascading effect. So I'm hopeful that, at least I've seen it from 10 years ago to now, that the biggest acceleration happened over the last 3-4 years, and especially post-COVID. So I'm confident that, we will see this happening. But one place where maybe it would help a lot more would be if insurance covered these tests, right? And that would allow us to have a more widespread adoption of some of these tests, at least for things like, if we can create, let's say, everybody can be covered for Medicamap, I think it will save a lot of lives, because a lot of hospital deaths happen because of wrong medicines. And it's not that the doctor gave the wrong medicine, it's just that the medicine didn't work for that patient. So I think those are the things that I feel are, they are win-win for everybody, whether it is a doctor, whether it's a hospital, or insurance company, as well as consumers. But I think we are yet to see that coming to a large enough scale yet.
Fantastic.
Sorry, disturbing you.
No. Thank you.
Yeah.
I think that would, that's a very succinct, a way of saying why is it important, and I think it's very, very clear. I think I'm very happy to learn so much about genetic mapping today in an hour than I probably kept on reading books on and talking to friends and family. But thank you for your time. It was really, really nice chatting with you and conversing with you.
Absolutely. It was an absolute pleasure talking to you. And I know that we can continue talking for more than, at least a few more hours on these topics. But I do understand that, we've gone over an hour, and that's usually, that's when people will lose their attention. I think we can continue talking. So maybe we'll leave it for another time and another day, where we can have more discussion and see where it has progressed. Maybe discuss more about all the newer things, like you were talking about, CAR-T therapies or others that are interconnected with a lot of what we are doing and others. So thank you so much. But before we close, can I ask you a couple of quick questions and not related to genetics?
Sure, please.
Okay. So what is prevention according to you?
Prevention is knowing about yourself, about your genetic makeup, about your your biological makeup in advance, and so you could take an action to prevent yourself from falling sick in the future. So do things now.
And what do you do to look so young?
Oh, really? Okay. Well, I eat a lot of vitamin C based fruits. I think it's all about food, I feel, and maybe a little bit of good genes from the parents.
I think so. That's the best blessing you can get, I think, to get the right genes, but also about all the food that you're eating. Any favorite book or movie?
Favorite book or movie? Book would be, we're talking about genes. So I think Gene by Siddharth Mukherjee was one of the very captivating books, and it kind of brought back all the memories of medicine and everything that we had read, even from actually not just medicine, but even 11th and 12th, where you read about a lot of scientists and the different theories in biology. So Gene would be one book that I would totally read again. And you said movie, is it?
Yeah, movie, if you can, if there is something that you can.
That's a tough one. So many. I can't name one. Movie buff.
You're a movie buff. Okay, then you have too many movies to choose from.
That's what. Too many movies to choose from.
And I guess you've seen the Netflix the 100 Years one.
Oh yes,
Yes.
yes.
So
That's a
I
good.
think we did a research as well. I don't know if you're aware, but we did research on people who live to 90 and beyond, to see, was it in their genes or was it their habits? And hopefully we'll publish that soon. So,
Oh, nice. Waiting to hear, and probably I'll call you to get a quick
sure.
glimpse of that.
Absolutely. Yeah. All right. Great. So I will, the one last question. Are you morning person or evening person? Night person.
Evening and night person. Totally. Very against what my Genomepatri said, but an evening and night person.
I think it's also how we have like over a period of time changed our habits and got comfortable with people. So all right. So
But I think that's one place where most of the parents would really love to have genome mapping done, because they could substantiate whatever they've been telling their kids with a Genomepatri. See, now your genomes also say the same, so sleep early.
Yeah.
So I think that's a good reinforcement.
Yeah, I think I should have done it earlier as well. So then you would know. But now I got too used to late nights, and I'm trying to change my. So if there was from food, sleep, and diet, what do you think is the most important? I know all are, but
Food, I think. Food is the most important. From personal standpoint as well as I think health standpoint, it's super important.
okay. Great. So I will not take up more of your time. I think it was great. We've had a fantastic conversation, and hopefully we will continue to keep up discussing, talking offline or online, wherever we can.
Same here. Look forward to learning a lot more from you, and all the best to Map My Genome. It's a fantastic. You're doing a fantastic job of bringing genetic science to the mainstay. So congratulations and all the best again. Thank you so much for your time.
So much. Thank you.
Thank you. Take care.